My name is Jennifer White, and I am a licensed practical nurse in the baccalaureate program at Indiana State University. This is my third health education project in the spring of 2021 for Community Health Nursing Class 444. I will be discussing lead poisoning in children. By the end of this presentation, the participant will be able to 1. Provide the definition of lead poisoning, 2. Outline the causes of lead poisoning, 3. Identify the signs and symptoms of lead poisoning, and finally, give examples of the treatment of lead poisoning. Please pause the video here and take the pretest listed in the comments below. In the early 1990s, lead gasoline was phased out because it was realized that lead exposure was hazardous to mammals and to birds. Lead is a heavy metal whose chemical element symbol is Pb. According to Jahadi et al. 2016, the World Health Organization has recognized lead as one of the 10 most dangerous chemicals for humans. It has been established that even low levels of lead exposure in children can lead to severe complications. Lead is carried in the blood and mimics calcium, so lead levels can interfere with cell functions such as the production of heme. Adults who are exposed to lead can present with higher blood pressures, which causes cardiovascular disease, as indicated by Gottsfeld 2017, and can eventually lead to death. Most children with lead poisoning do not show any symptoms at first. Those that do can show early symptoms which may include weakness and fatigue, which is caused by anemia because of reduced or low heme production. The child may also have colicky abdominal pain if they are exposed to high levels of lead. There is also the risk of coma, seizures, or death at high levels of lead exposure. Jahadi et al. 2016. Later effects of exposure to lead can lead to cognitive issues for children. These issues can include lower IQ scores, learning disabilities, and behavioral problems due to neurological damage from lead in the tissues. Lead is able to pass through the blood-brain barrier in children and is then deposited in brain tissue. Lead poisoning is considered by some to be a problem for earlier in the century that has been generally eradicated. This is not true. Lead was widely used in house paint and paint on metal toys. Cars used leaded gasoline and water pipes were made from lead. America phased out leaded gasoline in 1996 under the Clinton administration, and paint was no longer made with the lead base for interior use. The problems arise now when children live in low-income, run-down houses in older, poorer neighborhoods. These homes may still have lead paint underneath any renovations, if there were ever any renovations even completed. Children have a tendency to stick everything in their mouths, and especially when they are teething, will gnaw at anything they can. This can include windowsills, and door jambs. Some children may also suffer from an eating disorder called pica. This leads them to eat things that are normally non-ingestible or non-nutritional. There are many causes for pica, which can include stress, nutritional deficiencies, and pregnancy. Lead can cross the placenta, and if the mother ingests it, the fetus can be exposed. The ingestion of lead is the leading cause of elevated lead levels in young children. The second leading cause of lead poisoning is by inhalation, so caution must be taken when renovating an old home to reduce dust levels. Lead is still used in the manufacturing of batteries, and many countries that produce lead batteries are not as regulated as America is. Gottsfield, 2017. Lead batteries are used in cars, as a storage place for wind and solar power, and as backup electrical sources for computers. According to Jihadi, 2016, the CDC has set the level of blood lead at 5 micrograms per deciliter as a reference threshold. Anything over this level is considered lead poisoning. A blood test to measure the levels of lead in the blood is the only way to diagnose lead poisoning. The only true treatment for lead poisoning is to identify the source of the lead and completely eradicate it whenever possible. This may include scraping the paint off of walls or completely tearing the interior of older homes to the studs and replacing all of the walls and the trim. This can be accomplished with the assistance of government regulations on housing safety. The patient may also have to undergo therapy for the eating disorder if this is the cause of the lead ingestion. This can include stress management, dietary changes, and government assistance to ensure the patient is getting the correct amount of food calories per day. The treatment of the symptoms is also a priority and can include hospitalization and ventilator support if there is cerebral damage. In acute ingestion of lead, gastric lavage can be used to flush the lead from the stomach. Lead poisoning is a reportable illness, and physicians must be diligent in this reporting to ensure public health safety. Pediatricians and general practitioners must be aware that lead poisoning is still a viable diagnosis, and continued education is a priority to keep this problem regulated.